Hello students, today we will talk about the perineal body. Now when you will have the perineal body, this is the very important concept of your perineum because perineum is having the muscles and all the muscles will go and they will insert into this structure which is known as perineal body. Apart from that, when you will have the episiotomy, which is a procedure and that procedure we used to do at the time of the delivery, you will realize that this perineal body is having very special importance. We have to avoid the damage of this perineal body. Otherwise, in the coming life of the female, there is a laxity occurs in the perineum and the pelvic organs may prolapse. So, because of these two reasons, you should know about the perineal body, its formation and its structure. So, when we are talking about the perineal body, the first thing comes is that perineal body is an ill-defined, though it is a ill-defined structure, but still it is very important. Apart from that, when you will see the perineal body, it is nodular and it lies in the perineum. So, if somebody will ask you what is perineal body, so your answer in one line is that it is a nodular structure of perineum. It is a nodular structure of perineum. Now, this nodule present in the center of the perineum. Now, this is something is important to understand that if we will see a line, now see this is the perineum when you are seeing the perineum from below. Now, if I will draw the line and this line starts from this anterior point to the posterior point and almost this center is having the perineal body here in both male as well as in female. Clear? The second thing is that it consists of fibromuscular tissue. Now, this is something is important and so many times you have this question that perineal body made up of which type of the tissue. So, it is having the very large number of the muscle fibers, which I already told you in the starting of the lecture that the perineal muscles will go and they all will attach at one point and that is known as perineal body. The muscles of the pelvic floor and the perineum attached to it. Clear? So, there are two sets of the muscles coming. First is the muscles of the pelvic floor and second is the muscles of perineum. And we know that perineum is the inferior area below the pelvic floor. Clear? Now, what is exact location of perineum? So, when you will see the exact location of the perineum, you have to understand that it is at the center of the perineum in midline, approximately midway between the two ischial tuberosities just anterior to anus. Now, this is most important question of the positioning about perineal body. Now, here in these two images, if you will locate the perineal body, where you will find. Now, this is your anal opening or the anus in the posterior triangle or anal triangle of perineum. Now, just anterior to this, you will have the location of perineal body which is here. Now, when you will see this image in a person, and you have to do the surface marking in the perineum, you have to first mark the anal opening. So, this is your anal opening. Now, just 1 centimeter in front of the anterior border of anal opening, we are having this fibromuscular node and this is known as perineal body. So, perineal body is not going to make any surface elevation, but if I have to mark the position of this perineal body, I have to first mark the anterior border of the anal canal or anal opening, and once I will mark the anterior border, I have to make a 1 centimeter anterior to this anal opening, and that is the position of perineal body. Now, the next is what is the importance of perineal body? Why you are reading the perineal body? So, the muscles of the pelvic floor intersect with the muscles of perineum. Now, we have seen in the overview class of the perineum that perineum is having two pouches, superficial pouch and deep pouch. And the perineum is the area which is below the pelvic diaphragm. So what will happen? Now if you will see this image, now you are able to understand here that this is your pelvic diaphragm, and in the anterior part of the pelvic diaphragm we are having a defect or the hiatus which is known as urogenital hiatus. And you know that this hiatus supported from below by the pelvic diaphragm. So this is your anal opening or the hiatus to allow the anal canal to enter into the perineum. And I told you that 1 centimeter anterior to this here you will have the perineal body. So what will happen that these muscles of your pelvic diaphragm, which muscle? These muscles of the pelvic diaphragm will intersect into this perineal body, and you will have the muscles below this area which are going to form your perineal pouches also come and intersect into this point only, and these muscles which are coming here are going to form your urogenital diaphragm. So the question is that perineal body receives the muscle of, answer is pelvic diaphragm and both superficial and deep pouch muscles. So this is what you have to keep in mind, that whenever we are talking about the perineal body is a area or the nodular point or the center point of the perineum which receives not only the part of the levator muscle but also the muscles of superficial and deep both perineal pouches. So the levator muscle has a defect known as urogenital hiatus. So now this concept is very important to understand, that what is the need of perineal body. The only need of perineal body is to support the perineum and pelvis from below. Because my dear students, you have to understand that when we are talking about the circumference of your pelvis, you realize that there is no bone in the center. Whatever the pelvic organs are present in the pelvis, they are supported from below by the muscular areas only. And the major muscle which is present in the pelvis is known as pelvic diaphragm, and these muscles are supporting the organs which are present in the pelvis. Now the question arises that for the exit of your vaginal canal and urethra in female, you have a big gap anteriorly just behind the pubic symphysis. Now this gap is known as urogenital hiatus. So this is urogenital hiatus because through this you have the exit of genital system, that is vaginal canal as well as urinary system. Now this area or this defect you have to close. Otherwise what will happen, if such a big defect persists, the organ will sag down. So the levator muscle has a defect, and this is known as urogenital hiatus, the posterior end of hiatus connected to the perineal body. Now this is something, again the important thing is that when you will see the position of perineal body, where you will find in relation to the hiatus. So the answer is that here is your perineal body. So perineal body lies on the posterior margin of this defect. And second thing is that this perineal body is below the diaphragm, not above the diaphragm. The second thing is that the muscles of the perineum intersect with the muscles of pelvic diaphragm. So because the perineal body lies below the pelvic diaphragm, and below the pelvic diaphragm you are having the perineal muscles which are present in the different pouches. So what will happen? The muscles of the perineum intersect with the muscle of pelvic diaphragm in this perineal body, and ultimately what is the output? The output is that these structures strengthen this defect or the hiatus in pelvic diaphragm. So the perineal body supports and prevent the sagging down of pelvic organs. Now this is the question, that what is the need of perineal body? So my dear students, this point should be very clear in your mind, that suppose you are having a hall, you are in a room, and you have to decorate the upper part of the room, and you will hang multiple ribbons which are coming from the wall of the roof. Now what will happen that all these ribbons, if I will tie in the center, what will happen that you are having a radiating manner arrangement of all the ribbons which are going towards the different wall of the room from that center knot which you have tied. Now suppose you are dealing with the perineum where the muscles are attached all around on your wall, but in the center you don't have the bone to insert these muscles. So what will happen? All these muscles intersect with each other and make a nodule that is equivalent to the knot which you tied with the ribbons, and that node is known as perineal body, which actually is an intersecting point of all the ribbons which are coming from different direction in center part of your room. So this is what you have to understand, that if I will cut the knot, all the ribbons will fall down. In the same way, if I will cut or damage the perineal body, the pelvic floor will become lax. And if the laxity is there, what will happen? This defect or hiatal opening enlarges, and the organs which are present above the pelvic diaphragm undergo sagging down, and prolapse of the organs will occur. So now the question comes is, write down the name of muscles of perineum and pelvic diaphragm which are going to intersect at this node which is known as perineal body. So there are 10 muscles. Now this is something is important. Sometimes you have this question. So when you are writing these 10 muscles, first you have to divide the muscle in two parts, because we are saying that the muscles of pelvic diaphragm as well as muscles of perineum intersect. So which are the muscles of pelvic diaphragm? So there is only one name, and that is known as pubococcygeus component of levator ani. Now this pubococcygeus component of levator ani is present here, and you are not able to see here. Why you are not able to see in this anterior part? Because this white color free border which you are able to appreciate here is your perineal membrane. And I as already explained this in my class of the perineum, that this perineal membrane lies below the pelvic diaphragm, and it is an inferior fascia of urogenital diaphragm. So now you have one pubococcygeus muscle, and this pubococcygeus is a muscle which is present here. It will going to make this type of the arrangements, and this pubococcygeus will intersect here. Then you are having the muscles which are present below the pelvic diaphragm, that means the muscles of perineum. Now when you will see the muscles of perineum, you will have muscles of both pouches, deep and superficial. So here you have the muscles of perineum, and out of these muscles there are superficial transverse perini. Now superficial transverse perini is a muscle of superficial pouch, which you can see here that this is your right side muscle, this is your left side superficial transverse perini. So both muscles are arising from the hip bone, and they are going medially, and on the medial side they are ultimately intersecting or inserting into this perineal body. Then you have the deep transverse perini. Now deep transverse perini is a muscle of the deep pouch. Then you will have the two bulbospongiosus muscle. So where is the bulbospongiosus muscle? Here you can see this is the one side bulbospongiosus, this is another side bulbospongiosus. Clear? Then you will have the single muscle of external anal sphincter. So here you can see where is the anal sphincter. So this is your anal sphincter, and you can appreciate that this anal sphincter muscle is also having the fibers, those are anteriorly supported by this perineal body. Apart from that, you have the smooth muscle fibers of the longitudinal muscle coat of anal canal. So on the inner side, you will have this longitudinal muscle which is just inside the external anal sphincter, and these fibers will also have attachment with the perineal body. Then there is one important thing which you have to understand, that these muscles which you are reading acting as a sphincter, and these sphincters are controlling the different openings like urethra, anal canal and vaginal canal. So now when you will see this list, it is quite clear in your mind that if I will damage this perineal body, what will happen? All these muscles will have laxity because their medial attachment, or I can say this medial interlacing point is become weak, so the laxity will occur in the pelvic diaphragm. Now in this image also you can appreciate the same things. Now here you can first find out this is the location of perineal body. Now this perineal body is receiving these two muscles which are known as bulbospongiosus muscle. Then you are receiving the transverse perineal muscle which is here. Now deep to the transverse perineal, this white sheet is the perineal membrane. So if you will remove the perineal membrane, you will find the deep transverse perineal muscle. Clear? Apart from that, from posterior side you can see these are the fibers of your anal sphincters, and these are also attached to this perineal body. Now my dear friends, you have to see all these things in this video clip, where you will find that this is the inferior view of your pelvis, and you can see that this is the pelvic outlet where you can see the perineum. Now in this perineum, first you can see this is your position of perineal body. Now this white color nodular area is perineal body, which is just anterior to the anal opening behind the vaginal canal, and here you can see the muscles. This is your two-side bulbospongiosus, transverse perineal, superficial, and these are the anal sphincter. Now if we will remove these structure one by one, what are the other things you are able to find? So let's play this clip. So when you will have this video clip, you are able to understand that now we have removed the muscles of superficial pouch, so you can see the perineal membrane. Now we have removed the perineal membrane, so you can see the muscles of the deep perineal pouch, which are the deep transverse perineal and other sphincteric muscle of the vagina. Now this is what is your pelvic diaphragm. So the muscles which are present here along the hiatus are also intersecting into this perineal body. So in nutshell, you have to understand that when you are going from superficial to deep, you will realize that perineal body is receiving the muscles of superficial pouch. Then if you will remove the perineal membrane, you will find the muscles of the deep pouch also inserting, and if you will remove the muscles of deep pouch, you will find the urogenital hiatus is become prominent, and this much large gap has to be supported by the areas which we have already removed. So if you will not support this hiatus, this weak defect becomes the site of the prolapse. Now in this video clip, again you have to understand how this, why this perineal body is so important, and if the urogenital diaphragm is absent, what would be the consequences. So here you can see first this is the pelvic cavity, you will find bladder is present here, the uterus is behind. Now if you will rotate the pelvis and if you will see from below, now what you are able to appreciate that this is your urogenital hiatus, and right now you don't have the pelvic urogenital diaphragm. So now if we will remove the vaginal canal, if we will remove the external genital opening, you can find out this big gap is there. So my dear friends, you have to understand that the organs which are present in the pelvic cavity will come out through this hiatus, and there is a big gap present after exiting the vaginal canal and urethra, and that gap has to be supported by external support, and that external support provided by the muscles which are present in this area, and they are known as muscles of perineum. And all these muscles will go and they will intersect at this point. So if you will damage this point, the laxity will occur in this defect and the person will have prolapse. So now we will come to the last part of the class, that what is the applied anatomy. So the damage of perineal body often leads to the prolapse of the uterus, which is very common out of the pelvic organs. Most of the time the females will have the prolapse of uterus following the injury of perineal body. So, apart from that, there may be injury of anal sphincter, and anal sphincter injuries are more associated with the injuries of perineal body at the time of vaginal delivery. Now, what will happen in the vaginal delivery, that at the time of the birth, when the head will come out, what will happen? There is a overstretching of the vaginal opening occurs, and that overstretching of vaginal opening may have the tear which will go posteriorly, and it will first damage the perineal body. And if the tear is so large, it may rupture this anterior wall of anal canal where you have the sphincters. So, that is why the anal sphincter injuries are more commonly associated with the injuries of perineal body at the time of vaginal delivery. Clear? Now, to avoid these vaginal injuries, we have to go for a procedure is known as episiotomy. So, episiotomy is an incision. It is a surgical incision which is intentionally or prophylactically given, and this incision given in the posterolateral side of the vagina to increase the size of outlet or to enlarge the perineal opening for the baby birth during delivery. And it is a cut which is put there prophylactically, and it prevents the unstructured tearing of perineum. What does it mean? That we are also initiating the tear of perineum, but it is a structured tear. It is a controlled tear. We know that we have to prevent the injury of perineal body. So, we are going to make a cut here on this posterolateral aspect, so that the cut on the posterior side should be avoided, and it prevents the injury of perineal body as well as anal canal. So, what are the structure we use to cut in the episiotomy? Or sometimes you have this question that name the muscle which usually cut in the episiotomy. Answer is bulbospongiosus. Now, here you can see that this is bulbospongiosus, and this muscle is usually cut during your episiotomy. So, let us see that how episiotomy has to put in this image. So, this is your perineum. Now, here we have removed the skin, and once you will remove the skin, you will realize what are the structure lies deep, because you have to first keep this thing in mind that when you will remove the superficial layers, you will find the superficial perineal pouch. In this superficial perineal pouch, this is your muscle, and this muscle is your bulbospongiosus. So, this is your bulbospongiosus muscle. Now, you can see this bulbospongiosus, and we will make a cut where? Now, when make a cut, we cut like this. Now, this cut is going to make an incision on your vaginal canal skin, subcutaneous tissue, and this muscle which is known as bulbospongiosus. So, you will remain into the superficial perineal pouch. You can see that perineal membrane is here. So, we are making an incision in the superficial pouch. We are cutting this muscle which is known as bulbospongiosus, and we are avoiding the tear to go posteriorly. Otherwise, what will happen? That there may be an injury of your anal canal. Clear? So, at the end of this class, you should have the idea what is perineal body, which muscles come and connected at perineal body, what is the difference between the muscles of the pelvic diaphragm which attach to the perineal body and muscles of the perineum which are going to attach on the perineal body. And lastly and most important thing is in episiotomy, why we avoid the straight incisions, and why if the episiotomy will not perform, there is an involvement of perineal body and rupture of anterior wall of anal canal. So, this is all for today's session. Thank you.